Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic. Welcome to this episode of Health Talk. Today is a very interesting, distinguished guest that we have. We're going to be talking about the opioid crisis and how it's kind of affected our local community on, a state level, a local level, and a national level at this point. We have two great guests here. We have Marcy Topol, State Representative from the District of 147. Dr. Karen Hahn from New Hanover Chiropractic. She's been in practice for 17 years, graduated from New York Chiropractic College. So we're very pleased to have both of them on our show here today to give us a little bit of information about what the latest is about the opioid crisis, narcotics, what all this means, and all that type of stuff. So from our perspective, there was a resolution that was kind of brought a couple months ago. I think it was Resolution 597. Can you explain what that is?
Well, we were recognizing chiropractors in the month of October and the service that they provide to our community. Mm-hmm. So we designated the entire month as Chiropractic Health Month.
That's awesome. In that, what prompted that type of state action, do you think?
I do believe the opioid crisis certainly was one of the factors in considering raising awareness of what the chiropractic practice brings to pain management and
Sure.
treatment. We're certainly experiencing an epidemic of opioid use, not only use, but of overdoses.
Sure.
And we see it even locally here in Montgomery County.
Sure.
So we're trying to raise awareness of the issue.
Right. So in the step of awareness, is the goal of 597 to show alternatives to, we'll say opioid medications and that type of stuff? Instead of them being kind of the first line of defense, we're trying to show a different perspective that people may or may not know of?
Exactly.
Okay.
I think that in the past, that was the first line. You go to the doctor, he writes a script, you
Sure.
go to the pharmacy, fill it. You're not really aware of some of the risks that you're taking in doing that. So we're very interested in raising awareness of alternative forms of pain management.
Sure.
And of course, the chiropractic health care provides an alternative to pain management.
Sure. So Karen, just bring you in on this. So what does a chiropractor do?
We basically evaluate our patients, take a full history on them, take them through a full exam, orthopedic, neurological, range of motion, palpatory. We have x-rays, provide a diagnosis, and give our patients a treatment plan to help treat spinal pain.
And is that done with medications? Is that done as a non-medicated type of treatment? How does that all work?
We don't use any medications, and we try to help our patients avoid surgery.
Wonderful. So Marcy, as we come back and you start to think about what an opioid is and what it does, what does an opioid do?
It actually reduces pain.
Okay. I thought this was very interesting when we were preparing for this show and that type of thing. What were opioids originally used for?
What I've come to learn is they've been used to treat cancer originally.
Yeah,
but of
cancer
course,
pain.
their use was expanded beyond that original purpose.
Sure. And so now we start to see that a medication that has an addictive quality at this point is now being put into a treatment plan that has, I will say, a bigger funnel for people to be given that medication to at this point, which means that our addiction rates would go up. So in that process, what have we seen on a local level on addiction, maybe on overdose, maybe on death?
We've heard some very, very sad stories. I've gone to hearings across the state on
Sure.
this issue where we've heard from parents whose, really young, their children they could have been athletes or had a really promising future, and they experienced an injury. Go to
Sure.
the doctor, they're prescribed an opioid for pain, and that leads to a life of addiction. Sometimes a life of addiction, and worst case scenario, sometimes an overdose and death.
Sure.
So they're very sad stories. Locally, I've had many parents and grandparents come in to talk to me. In fact, I did a video of a lot of families locally who've experienced a loss, an
Sure.
overdose loss of one of their children or grandchildren. They're heartbreaking stories.
Can you
Stories of parents who need to administer naloxone to their own child to bring them back to life.
Sure.
So it's everywhere, and it's across all barriers. It doesn't really matter what kind of family, wealthy, if you're, not so wealthy, it hits all families. In Montgomery County, in fact, 1 in 4 families are experiencing an abuse issue within their family.
Wow. I think what was really interesting is that when we looked at some of the stats, and Karen, you probably can validate this as well, I think in the year 2000 there was something like 1,900 deaths, and then over the last 20 years, I think it has ballooned to over 400,000. So now they're saying that, it's, I think, 139 deaths per day from these types of opioid overdoses and that type of stuff, which is just, you start to put the context of the epidemic and the crisis into context now. These numbers are staggering.
They are staggering. In fact, we're hearing for young people, it's now the #1 cause of death. It used to be a car accident.
So
Young folks get in a car, they don't drive, so they don't make the best decisions. But I think the opioid crisis and the drug overdose issue has surpassed even car accidents as the #1 cause of death.
Gotcha. Karen, so again, in your clinical practice and that type of stuff and what you've seen, do you ever see where medications are just given out too easily on a narcotic basis at this point, where it maybe shouldn't be?
I believe so. I think I don't want to say a standard, but maybe a standard has been set that if you go to your doctor and you're in pain, that's the way that they're trained to treat
Sure.
the spinal pain.
And so then that leads to other things. Do we have any stats, or do you have any stats on how much, you go from an opioid prescription overdose into maybe illicit drugs such as heroin? Is there a gateway to that? Is there a connection to that, or do we not know
There
that?
certainly can be. I don't have any numbers with me
Sure.
on that, but that is the story that we hear. I
Okay.
mean, when you're talking about quantitative data, I don't have that.
Sure.
But the stories that we hear as we've traveled across the state with these hearings is that happens over and over again. It starts out with a script and ends up in illicit drug use.
Right.
When they become addicted and the doctor no longer wants to write the script, they
Gotcha.
find a way to get it someplace else.
Yeah, it's very disheartening and very saddening, that's for sure as well. What would be your take-home message, as you're looking at the viewers and that type of stuff, of what they should be thinking from your vantage point? Because I'm going to ask Karen the same thing, what her vantage point is from a clinical standpoint. But you as being a mom, you being a representative, what would you say the take-home message is out of everything that you've learned so far in your journey?
And I think I always first look at every issue through the lens of being a mom and a
Sure.
grandmom,
Sure.
and try to keep my own children and grandchildren safe. So I would always, this awareness issue, just don't assume it's not going to happen in your family. It can
Right.
happen in any family. Number one, know it's out there. Know that it's accessible to children and students. And when you go to the doctor, ask questions. I mean, if you're prescribed an opioid or a pain reliever that is a narcotic, please ask questions if it's necessary. There are places out there for treatment if you are experiencing some kind of addictive behaviors.
Sure.
Please seek help. You can contact my office and we can get you in touch with people.
That's wonderful. So Karen, now as we shift gears from we'll say the social end of it to more the healthcare end of it, you as being a chiropractor, being in practice for almost 20 years right now at this point, what can a patient expect if they would come into this office and have your treatment? I know you went through the history and that type of stuff, but what would their experience be after that?
We provide adjustments or spinal manipulative therapy, as well as manual therapy such as active release technique or Graston or myofascial release. We also do therapeutic exercises to strengthen and correct muscle imbalances. We have other use of modalities in the office like electric stimulation and ultrasound.
So what have some of the outcomes been for you?
Our outcomes have been great. Our follow-up studies on our patients 1 year after the fact are showing a high 90% in outcome assessment as well as patient satisfaction rate.
Is chiropractic safe for disc herniations? Is it safe for arthritis? That's a common question that I think a lot of people want to know, because if that is something that would deter them from seeking alternative care, this is something I think that would be very important, because when you look at the research on safety, it started in 1986. So what do you see in your own clinical practice?
Chiropractic care is extremely safe. The only adverse effects that we really see are muscle soreness. We have, in that study in 2007, it showed no increase in pain. It showed actually a decrease in pain and an improvement in function 6 weeks after or worth of care of chiropractic care.
Yeah, I think this is of note that we want to kind of pay attention to. The study that Dr. Karen was talking about was led by Dr. Chow, who's a medical doctor, led a team of medical doctors, and they looked at discogenic sciatica, confirmed by MRI that people had a disc herniation at this point, and then they had the radiating pain coming down the leg. If I remember correctly, when we were looking at this study, I think that they had a 1.6 and a 1.7 effect on leg pain and function. And what that means to us is that just means that they had a great effect on the reduction of pain and the improvement of function. Is that correct?
Correct.
So with that being said, we start to see that not only is chiropractic care safe, but it does have an effectiveness, which then I think brought the state into this, because that was a published study that I think that you have become aware of as well. Is that correct?
That's correct.
Yeah, so now all of a sudden we start to see that disc herniations and arthritis and that type of stuff can respond to some of these types of cares without having the influence of an addictive medication. Sets things apart, I would have to say. All right. So again, Karen, then coming back to your end of this, what would be your take-home message as you start to think about what you'd want the viewer to look at and to consider?
I think that chiropractic care should be your number one or your first choice for neck pain and back pain. It's extremely effective, not in just outcomes, but also cost effective. And we're able to treat our patients without the use of drugs and avoiding surgery.
Absolutely. And I kind of even come back to this because I also have a personal, component with this as well. I mean, when we look at, from an employer standpoint, I think some of the stats that you had provided to us is that, it's $18 billion annually that employers take on from sick days lost, productivity, medical expenses, co-pays, and that type of stuff from a person that has the use of an opioid or a narcotic at that point. And then one of the studies I just found out last night is that I think it was in the first 30 days of one single dose of opioid that there's a 400% chance of suicide. Which is just, these are mind-blowing stats when you start to think about it. And so, and then you start to think about the collateral damage that sits out not just in the person who passes, but the family. So, and that's some of the stuff that I think that you have said that you've seen, and that you've been so, we'll say, touched and moved by. Is that correct?
Yes. I mean, it's devastating, right, not only to the family, but the community at large. We're losing a whole generation of people.
Sure.
And certain industries we know are affected more heavily, certainly the construction industry. We see that when you talk about workers' comp, and we've tried to make some inroads there in the formulary and add some more oversight to those kinds of things. We've run into some resistance, but clearly there are folks out there that it's not their fault. They're getting sort of entangled into this addictive situation where all they wanted to do was to have some relief of the pain that they're experiencing.
Yeah, and I think that this is also some of the stuff that I've come across too, that is that when you start looking at how we've come to this point, there's really nobody to point the finger at, because what happens is that it seems that it just became, these were the guidelines that, doctors were said to follow at that point. And so you look at that, and then all of a sudden it just kind of has blown up in, I'll say, in our whole experience at this point, that has turned out to an outcome I don't think anybody ever anticipated or ever kind of even foresaw at this point. But we're here now, and so this is where we have to start trying to make I think a significant difference in impact in people's lives, and we all stand in a great platform to do that.
With the knowledge that we have now, I think there's other options and better options than opioids.
I often kind of think about this, and I'll kind of even close with this, is that could you imagine that if 139 people died every day in an airplane accident, what would happen to everybody at this point, and how all that would be, we'll say, construed, and airlines would be grounded and that type of stuff. And I think that's where we're at right now. We're losing so many people per day that we're finally starting to take note of where we need to go with this whole thing. So I thank you very much for both coming on to the show. I think that it's a great topic that we need to continue to explore and come across and show viable options that we're looking at so people can make informed choices. So, good day and good health.